Assalamualaikum and hi to Sir Muhammad Azhar. So today we would like to present about physiological adaptations. Firstly, let me introduce my group members. My name is AFIQAH HANIZAM and my student ID is 2023866244.
My name is NATASHA YUSOFF and my student ID is 2023891626.
My name is SOFIATUNIZA binti SALIM and my student ID is 2023829842.
My name is HANIS MAISARAH binti FOUZI and my student ID is 2023865618.
So this is our topics for today. First of all, introduction of physiology adaptations of the respiratory system. Respiratory adaptation is the specific change that the respiratory system undergoes in response to the demands of physical exertion. Intense physical exertion, such as that involved in fitness training, places elevated demands on the respiratory system. Over time, this results in respiratory change as the system adapts to this requirement. This change ultimately results in an increased exchange of oxygen and carbon dioxide, which is accompanied by an increase in metabolism. Respiratory adaptation is a physiological determinant of peak endurance performance, and in elite athletes, the pulmonary system is often a limiting factor to exercise under certain conditions.
Exercise-induced asthma. Is exercise-induced asthma real? Exercise-induced asthma, also known as exercise-induced bronchoconstriction, EIB, which is triggered by physical activity, especially during intense exercise. Yes, it is real and it affects both professional athletes and active people. So this is the symptom of exercise-induced asthma, which is coughing, wheezing, shortness of breath, and chest tightness usually occur during or after physical activity, which is triggered by physical activity, cool or dry air, and poor air quality. So this is tips and how to cope exercise-induced asthma. The number one is take the prescribed asthma medicine about 50 until 30 minutes before exercising. Second, warm up before exercise to prevent chest tightening. The third one, breathe through the nose during exercise. And the last one is, if air pollution or pollen are triggered, you can exercise indoor when air quality is poor or pollen counts are high. Playing sports with asthma. Having asthma doesn't mean you have to give up your athletic dreams. With proper management, medication, or guidance from your doctor, you can safely participate in sport and even achieve greatness. So the last one is treatment. Number one, speak to your doctor to develop an asthma action plan. Second, rescue inhalers may be needed for immediate relief. Third, use bronchodilator inhaler before exercise for prevention. Last one, steroid inhaler may be prescribed for regular use to keep inflammation down.
Next, respiratory muscle fatigue. Respiratory muscle fatigue occurs when the respiratory muscles are overworked, causing them to lose the ability to contract with enough force. This can happen when the muscles are used for too long or are subjected to too much load. Factors contributing to exercise-induced respiratory muscle fatigue. The cause of exercise-induced respiratory muscle fatigue is due, in part, to the high levels of respiratory muscle work that must be sustained throughout heavy exercise, as shown by the finding that diaphragmatic fatigue was prevented when diaphragmatic work during exercise was reduced by less 50% using a mechanical ventilator. After that, mechanism by which respiratory muscle fatigue could affect exercise tolerance. First, ventilation of dyspnea. Respiratory muscle fatigue could potentially limit exercise tolerance through an inadequate ventilatory response, an alteration in breathing mechanism, an increased sensation of dyspnea, or a combination of these factors. Relative alveolar hypoventilation would be expected to occur if the respiratory muscle were unable to generate the required pressure or a tachypneic breathing pattern cause high dead space and therefore reduce alveolar. Second, cardiorespiratory interaction. Perhaps a more likely aspect of respiratory muscle work limiting exercise tolerance is through a respiratory muscle fatigue induced metaboreflex, which increase sympathetic vasoconstrictor outflow and compromise perfusion of limb locomotor muscle, thereby limiting its ability to perform work.
Next, we move on to altitude training adaptation. But firstly, we must know what is altitude training. High altitude training is the practice of training at high elevations. In sports, high altitude typically means at least 7,000 to 8,000 feet above the sea level. At this elevation, there is less oxygen in the air. The workout will feel more difficult and the body will get tired more quickly. So, what is the adaptation altitude training? The first one is to increase red blood cell production. Hypoxia, or also known as low oxygen levels at high altitudes, stimulate the release of erythropoietin, EPO, a hormone that promotes red blood cell production. This increases oxygen carrying capacity. The second one is enhanced hemoglobin concentration. With more red blood cells, hemoglobin levels rise, improving oxygen transport to muscle. Third one is to improve capillary density. The blood may increase capillary growth, allowing for better oxygen diffusing to tissues. The fourth is increased ventilation rate. Breathing becomes deeper and faster to compensate for reduced oxygen availability. Next, greater mitochondrial efficiency. Muscles adapt to use oxygen more efficiently at the cellular level, improving energy production. And lastly, to enhance endurance performance. Post-altitude training, the body maintains some of the oxygen-carrying benefits, improving sea level performance in endurance sports.
Okay, so what strategy can we discuss to optimize respiratory function for improved performance in such a scenario? Okay, first we have breathing technique. Deep belly breathing, also known as diaphragmatic breathing, can help improve respiratory function. Pursed-lip breathing, which involves inhaling through the nose and exhaling through the pursed lips, can also help force more oxygen into the lungs. Okay, for the second one, we have respiratory muscle training. Respiratory muscle training, RMT, can be defined as a technique that aims to improve the function of the respiratory muscle through specific exercises. Inspiratory muscle training, IMT, in particular has been shown to increase inspiratory muscle strength, respiratory muscle function, and might help to reduce dyspnea on exertion. Lastly, we have regular physical activity. Regular physical activity helps your body make use of oxygen you breathe. This is also called your lung function. If you have a lung disease, like COPD, you may use more energy to breathe compared to others. By exercising regularly, you can decrease your symptoms and improve your breathing.
So the conclusion is the respiratory system exhibits various adaptations during exercise and physical activity tailored to meet increased oxygen demands and manage carbon dioxide removal. While general adaptations include enhanced ventilation, improved alveolar gas exchange, and the stronger respiratory muscles, specific conditions such as exercise-induced asthma, respiratory muscle fatigue, and the altitude training demands unique physiological response. Addressing this challenge requires target strategies such as respiratory muscle training, warm-up exercise, and environmental adjustment to optimize respiratory function and enhance athletic performance. By understanding these mechanisms, athletes and trainers can develop effective approach to mitigate limitations and maximize performance outcomes.
That's all from us. Thank you.